Have you ever noticed how the defense of vaccines takes on an almost religious tone? You're labeled pro-vaccine for supporting them, but raise any concerns and you're branded anti-vaccine. Vaccines are drugs, yet we don't treat other medications this way. No one calls themselves pro-Tylenol or gets labeled anti-Tylenol for discussing risks. Yet vaccines sit in this sacred category where questioning safe and effective is not allowed. During the COVID crisis, anyone asking honest questions about the shots was canceled. That experience shook me. It made me willing to listen to people I once dismissed as anti-vaxxers. In pharmacy school, we were taught to ridicule them, that they were ignorant and believed vaccines caused autism. The message was always, trust the experts. But after COVID, my trust in the experts had been badly shaken. So when my wife became pregnant, I decided to do my own research instead of blindly following recommendations. We read the vaccine-friendly plan by Dr. Paul Thomas and began taking a much more cautious approach. For example, we declined the hepatitis B shot for our newborn since my wife had tested negative and the risk was extremely low. Finding a pediatrician was eye-opening. Most required full compliance with the CDC schedule or they wouldn't see our children. We finally found one who seemed flexible, until he wasn't. He pressured us to eventually catch up on everything. He even mentioned that his other patients expected all children in the waiting room to be fully vaccinated. But here's what really surprised me. Pediatricians can receive large financial bonuses for keeping 90 to 95% of their patients fully vaccinated. That incentive explains a lot. We watched the documentary Vaxxed, which shares heartbreaking stories of parents whose children regressed after the MMR vaccine. We also learned about the CDC whistleblower who admitted data linking vaccines and autism was destroyed. I was shocked to discover that vaccine manufacturers and doctors have legal immunity and that taxpayers have funded over $5 billion in payouts through the vaccine court. By God's grace, our own children have been remarkably healthy with minimal to no vaccines. Our 20-month-old daughter has had 0 shots, and we've never needed to see a doctor. The Lord used this journey to pull me out of conventional medicine into a more holistic, root cause approach. I now see how deeply compromised many of our institutions are. In part 3, I'll share how discovering functional and integrative medicine opened up an entirely new way of thinking about health. By God's grace, my convictions on these matters have only grown deeper since I first wrote about this last year. The Lord has been so faithful to continue reforming my thinking to better align with His design for health and medicine. In His providence, He's led me to launch Reformed Health, my Christian functional medicine pharmacist consulting practice. If you're walking a similar path and would like some guidance, I'd be honored to help. You can book a consultation with me at www.reformed.health.